Hi, everyone. This is Michelle Gramoglia, the President and CEO here at Woodland Pond, and today is Tuesday, March 7th, 2023, and this is my weekly address. Today, I wanted to give you an update as to how our unannounced annual skilled nursing survey went last week with the New York State Department of Health, for those that have asked. As you know, I recorded my address a day early last week because, well, first of all, because of the weather that we expected, and then also because the Department of Health had arrived. And I would like to congratulate my team because the survey went incredibly well. We are still waiting for the official report from the state, but I can tell you that in our sort of unofficial exit interview that they gave us on Friday, they only reported one finding. So you think, gosh, well, what does one finding mean? I can tell you. They did find one error that a nurse made, but in the grand scheme of things, that is really incredible. The last data that we had, which was based on the last time we were surveyed in 2020, was that the average official number of findings, so the number of items that actually rose to the point of when the state compiles all of the findings that they bring back to their office when they leave the field, was that the average number of findings for a particular facility was 7. So we actually only had one during their unofficial departure. That means they take that back to the office. They talk amongst themselves, they talk amongst their team at the office, and then they decide. I expect that we will get the official report potentially today. And there's a possibility that even that one that they reported to us may end up not even making it to the official report. I don't want to get my hopes up too much because that would be truly incredible. We have not had a citation-free survey since prior to 2016. So that would be a little bit too much to hope for. Excuse me, but it really was incredible. So if you'll indulge me for a few minutes, just to give you a sense of what last week was like. First of all, tensions run a little high when the surveyors are here. It means that a team of 3 people arrived on Monday morning, and they stayed for the duration of the week, of course, going home at night. And they did not come Tuesday because of the weather. But the rest of the days they were here. They arrived early in the morning and they stayed throughout the day. This particular team of surveyors was extremely kind. All 3 of the surveyors actually were new to this role since COVID, was my impression. A couple were nurses and all were female. They are tasked with, as I had informed you last week, ensuring that all of the regulations that apply to our skilled nursing setting are being complied with. And I think that at this point, all of you or many of you know that our 3 primary levels of care, so independent living, assisted living, which includes assisted living and our memory support or garden view units, and skilled nursing, are all separately licensed and separately regulated by the New York State Department of Health. So this survey was specifically related to skilled nursing. Now, that does not mean that the survey just specifically reviews the skilled nursing unit, but it also looks at all of the areas that serve skilled nursing. So that means that the surveyors also surveyed the main kitchen, and that means everything that goes out of and comes into the main kitchen. So even though, you know, independent living dining and service comes from the main kitchen, all of that is part of the skilled nursing survey. It also included the laundry facility, which is downstairs in the basement, the loading dock area, the central supply and purchasing area, all of infection control, which is all of our policies and procedures and equipment and supplies that, of course, help us to prevent infectious disease on campus. And of course, everything in skilled nursing. So that includes environmental services, which some will colloquially refer to as housekeeping, all of the facility related items or plant operations, all of the services that happen the minute that you walk into the building there in the health center. So reception, security, the screening for COVID, making sure that we're testing the visitors for COVID and things like that. How we are ensuring the security of the residents there on the secure unit, which is skilled nursing, the physical therapy gyms, the skilled nursing meal service. How are we preparing the food items? How are the trays? Are the meals, the menus, the consistency of the diets correct? Are the orders correct for all of those things? Are the medication passes correct? All of those things. And they review medication passes. They review treatments. In other words, if someone has a skin tear or any kind of a surgical wound or a nebulizer treatment or oxygen orders, you name it. So they're looking at all of our electronic medical record. They interview residents, families, staff members. They ask questions about fire safety protocols, abuse protocols. They look at our policies and procedures. They look at training for staff. They review human resource files. They make sure that our fingerprinting that's required by the state when we hire new staff has been followed for a sampling of new staff that have been hired in the last 4 months. So they meet with our employee health nurse, Kim. They meet with Bridget Blum, our Director of Human Resources. And all of this is completely unannounced. We have no idea what sampling they're going to take. So again, where I said tensions are a little bit high, it's because we have no idea the specific things that they're going to look at. When they come in on that Monday morning, they give us a list of items. There's a list of items that we need to provide them within the first hour, the first 4 hours, the first 24 hours. That list changes each year. Again, we have not had a survey in 3 years, so this is a little bit blind to us. And again, we performed incredibly. I'm so thankful to the team. I'm so proud of the group. Everyone did an incredible job. We hit it out of the ballpark, and I'm just so proud of everyone. Now, as you know, the glow sort of wore off a little bit over the weekend. I did let the team know that not only are we subject to state surveys, but we are also subject to federal surveys. And that is because not only are we, regulated by state regulators here in New York, but because we are a Medicare participant there in skilled nursing, we are also subject to federal surveys because of that Medicare participation. And those surveys typically happen once every 5 to 10 years. We have not had a federal survey in many years, somewhere around 5 or 7 years. And oftentimes when you have a really good state survey, the federal surveyors are not far behind. So I have sort of let the team know that there's a very good possibility that federal surveyors could be very close on the heels of the state surveyors. So to not rest on our laurels and to be ready for those federal surveyors to show up anytime. The last time the federal surveyors came, again, was right after we had a really good state survey. So we are going to be prepared for that. So there's a good possibility that you might see us getting ready for a federal survey and dropping everything again to do that. So congratulations to the team. Incidentally, this process could repeat itself anytime now for assisted living in Garden View. They would be surveyed together by New York State because we have long overdue for an unannounced assisted living in Garden View survey. Different survey team, different process, but they are, again, long overdue for their annual survey. Their last survey, I think, was even prior to 2020, maybe 2018 or 2019. So again, that could happen anytime now. So just that's an update on those two things for you. Other than that, I don't really have much for you. We did get the results, and this relates specifically to independent living. We did get the results of the poll that we did for what our 3-month trial will look like for the pub for Saturday service. So for those that are interested in how that looked, it looks like not too many of you are interested in what we could potentially be offering for breakfast time. So we'll just kind of keep it with what we've got for breakfast now. We won't go too crazy on that. And it looks like not too many of you are going to be interested in what we will be offering to guests. So we're going to be keeping that trial very simple in the, second quarter of 2023. We will not be scaling that up significantly for what we currently offer for weekday service there at the pub, and we will see how it goes. We do need to make sure that we're at least breaking even with whatever staff and services that we're providing there in the pub during that trial. So that will happen right around the April 1st start date, and that will go for 90 days starting around then. Again, details will be announced about that. Looks like we're going to have some pretty moderate weather for the rest of this week, and I'll be around the rest of the week if you need anything. I hope you have a good one. Thank you.